front and center when it comes to the holidays is, of course, all the holiday food, right? You might want to try to avoid, you might be trying to avoid some of the favorites to keep those pounds off.
Unless you want to fit in a Santa suit next year without the fat part of it, right? It turns out it's not what you eat, but when you eat. Dr. Deborah Matthews here with us to talk about fasting. Intermittent fasting is a huge thing we're hearing about. You were just telling us before we came on, you just came back from a conference with thousands of doctors where everyone's talking about this. Why is this so popular right now?
Because it really works. You know, intermittent fasting can help you lower your blood sugar, your cholesterol, your blood pressure, and it has been shown by medical science that it can actually potentially help prevent heart disease, cancer, diabetes.
Whoa.
Celebrities are talking about this.
Tons of celebrities are doing it, right?
You know, Jimmy Kimmel lost 25 pounds and kept it off doing what we call the 5 and 2 method. So what he did is he ate normally 5 days a week, including some of his favorite meals, and then 2 days a week he fasted where he ate less than 500 calories.
Whoa.
This is also how Hugh Jackman slimmed down for his role as a Wolverine.
So how does it work exactly? What are the rules when you say intermittent fasting? What needs to be in place or what doesn't need to be in place?
Sure. So you're just changing when you eat and not worrying quite as much about what you eat. But what more people are doing are what we call the 16 and 8 method. This is how Kourtney Kardashian lost weight. So this is where you eat normally over an 8-hour window and then you fast for the other 16. And even if you don't fast for all 16, especially over the holidays, maybe that's a bit more than you really want to bite off. But even if you fast for 12 hours overnight, it can really make a big difference. And the thing is, this is simple. You don't have to count calories. You don't have to count points. You don't even have to give up all your favorite foods. And you lose fat, not muscle. That's why it works so well for the Wolverine. And like I said, we really do have medical science to show that this works. But there are some negatives behind it. So we said it's simple, but that doesn't always mean that it's easy, right? It can be hard to not eat when you're not supposed to, and it does take some discipline. And this is not a quick fix. I mean, this is something that's intended to be a new lifestyle that you're going to stick with over the long term. And we did say that you don't have to change what you eat, you're just going to change when you eat. But if you want to be healthy, you've got to eat some healthy foods. This is not a license to go to town on the junk food. But the good news is that you don't have to be perfect. So it really is something.
You can treat yourself every now and then.
You can treat yourself every now and then, yeah.
Well, thanks for bringing in the most unhealthy foods possible. Really appreciate that. Really helps me get jump started on this. Okay, so if you'll help me out, give me a 24-hour window for someone that has, most folks that are watching have a typical 9 to 5 type job. So give us an idea, break down. You wake up in the morning, let's say 6. So when do you eat, when do you not eat?
So you would wait to eat your breakfast till around 10 or 11.
Okay.
And then you would eat your supper, be finished by 6 or 7.
Okay.
And then not eat until 10 or 11 the next morning. And it works a little better if it's earlier in the day. I mean, if you ate from 7 to 2, that's probably even better, but that's harder for a lot of people. So it works better to just shift your breakfast a little later, make sure you're finished your supper a little earlier, and then don't snack in the evening, and then you're good to go. And like I said, even a 12-hour fast can really make a difference.
Let me ask you this from a safety perspective, because one thing that comes to mind is eating disorders and anorexia and things like that. Is there anyone for whom this may not be a safe option?
There is. So certain medications need to be taken with food to avoid side effects, so you kind of have to check with your doctor. And people who are diabetics, especially if they're on insulin, if you don't eat, your blood sugar can drop dangerously low. It could even be deadly. And you're right that a lot of our social interactions revolve around food. Christmas, the parties, they always involve food. They're usually in the evening. So you don't want to make yourself socially isolated. And how are you supposed to go out on that hot dinner date if you're not eating dinner?
Hello, yeah. Boy, I think about that all the time. So here's a question.
You can go on a hot dinner date with your wife.
I will. Yeah, that's true. Drinking calories is still calories. So if someone's like, ooh, I'm not going to eat, I'm just going to have some drinks tonight, you're kind of breaking the rule here, right?
In your body like sugar, alcohol.
Okay, all right. Now, you did mention, though, you said you could just dial back the amount of calories. Maybe it's not a 100% fast. You said under 500 calories. Is that right?
Yeah. So
what's an example? What's something that would be?
So there's kind of 2 different ways of doing it, right? You can do the intermittent fasting where you limit your meals on a daily basis, or you can just eat normally most of the days of the week, and then about 2 days of the week is when you dial it back to about 500 calories. So, for example, on Tuesdays and Saturdays, you could do this fasting where you're eating very little, and then eat normally on the rest of the days and not worry about the timing so much.
Dr. Deborah Matthews, we are fascinated. Thank you so much for coming in, and quickly leave with all of your cookies with you. Guys, come back for more Good Day. We're going to be back right after this.